Greetings to all the viewers of the Good News TV. Today I am going to speak on the topic childhood obesity. It is alarming to witness the rising cases of obesity amongst the children, and according to a report which is given by World Obesity Federation, it is stated that India may have over 27 million of children, which may lead to obesity by 2030. These figures presented in the report are alarming for India, as the country is not likely to meet the World Health Organization's commitment to halt the rising cases of childhood obesity by 2025. By 2030, India will have the prevalence of approximately 10.81 childhood obesity among the 5 to 9 years of age group and around 6.23 prevalence of childhood obesity among the teenager in the age group of 10 to 19 years. Why obesity is a concern is that it is a core associate for premature mortality, and it has become a true silent pandemic. It is no longer a symptom but a disease, and the incidence of obesity has increased in India from 600% to 700% from 1975 to 2016. The incidence of pediatric overweight cases is approximately 25% in urban India. The childhood obesity is now called as obesogenic environment. A fat and cuddly child is no longer a healthy child. Fatter is not better, it is for worse. So in order to understand what is childhood obesity, when we say childhood obesity and overweight, it is used synonymously, the term is used synonymously, but the term overweight refers to the excess body weight for a particular height of a child, whereas the obesity refers to the excess body fat. Overweight and obesity primarily happens either due to excess calorie or insufficient physical activity or both. And childhood obesity, we should not take it lightly because it is a forerunner of metabolic syndrome, poor physical health, jingduwai, mental disorder, jingduwai, respiratory problems, jinghikai, and a glucose intolerance, jingbam, biankashini hakamet. It may not be detected into the early childhood, but all these details can be tracked into the adulthood. When a person becomes adult, all these problems can happen to the person. Developing countries like India has a unique problem of double burden, wherein one end of the spectrum is the underweight and the malnourished, whereas the other end of the spectrum is the overweight and the obesity. Obese and the childhood overweight children have been found to have a higher preference of sweet and fatty snacks compared to the children with the normal weight. One interesting evidence which arises from the North India is that those children who skip the breakfast are associated to develop overweight and obesity and also health compromising behaviors. Food-related drivers are also very closely related to social structures, urbanization. When we say urbanization, is that urban residents, rural to urban migrations, and a psychological stress in the urban setting, increasing affluence, and also the child-targeted market. In our hands, we don't have so much statistic which are studied in the Meghalaya, but I would like to state some of the studies which done in Assam and the Kerala, where they have done the studies among the age group of children from 5 to 14 years reported the prevalence of overweight and obese children as followed, that is 3.5% among the boys and 4% among the girls. And also in Kerala, we see that they have done studies between the age group of 6 to 15 years, 3% children were obese and 10.2% children were overweight. The prevalence were higher to be found higher among the girls than the boys. So we cannot deny the fact that the prevalence of obesity is rising in India and more so often in the urban area. A significant proportion of 5 to 10 years children in India are overweight. So what can be the causes of childhood obesity? Ki ai kita ki dau ki bapan long ka Jingsngaid ha ka Jinglong Khynnah. Number 1 can be the lack of physical activity, jingduna ha ka jing kilanmid. So for example, like motorized transport, nowadays many of the children, a maximum of the children who are going to school, they are transported through the vehicles, they hardly walk, and a child playing outdoor games which is less than 30 minutes, they spend time to play outside less than the 30 minutes, and the children nowadays, they are overindulged in the indoor leisure activities and entertainment more than 3 hours, like for example television viewing, internet and the computer games. Lack of open space and the playgrounds in schools and the community, and along with the increasing pressure on the children to perform in the academics and the reduced emphasis on the sports contribute to childhood obesity. Television viewing is perhaps the best established environmental influence on the development of obesity during childhood. Number 2 can be excess calorie intake, where the child is given food or the nutrients which is more than required, and it can be traced not only when the child is growing but from the time when the child is born, a baby is born. A shorter duration of breastfeeding or no breastfeeding at all is given, and also if the baby is born low birth weight baby, where the birth weight is less than 2.5 kilogram or it is less than 2000 gram, 1000 gram, they are all considered as a low term weight baby. And we as a parents, we want our children to grow more fatter, to grow faster, and we try to feed more to the child, which we call it catch up growth, and later on it may lead to obesity. Ready availability of the calorie dense food, for example burgers, donut, fried chicken and fried chips, which are readily available and accessible to the children. Preference to an increased consumption of sweets and fatty fried food snacks, and also due to unrestricted access to energy dense food at various platforms like school cafeteria, school neighborhood, and those selling all this food, they have very low knowledge about the dietary components in the school children, and there is often increased calorie intake per body weight per day. Number 3 causes of obesity may be lifestyle related factors, karukam imjongi, like sometimes we give daily allowance like pocket money to our child, to our children, and which in turn the children may end up buying those foods which are not nutritious, which are not healthy. And easy availability of the domestic help, which leads all our household chores are taken care by this domestic help, and the children are less engaged in the domestic activities. Commuting to school by bus or car instead of walking or bicycling, and also one of the important causes may be because its influence on the television, which like for example aggressive advertising by transnational fast food and cola companies, which are some of the practices which predisposes children to obesity. Number 4 is socio-cultural factors and urbanization. Ki dustur haka imlang satlang. Like sometimes we are overprotective of our children, overprotection and force feeding by parents, and the false traditional beliefs and about the health and nutrition. And also we have sometimes we have money, we can buy so many things, but we have less knowledge about the nutrition among the parents and also caregivers, which may contribute in developing childhood obesity. Again, I would like to mention here is because of the limited availability of open spaces and parks due to population explosion or population increase in the population expansion and illegal settlements, with abundance of fast food outlets and eating points, which also increase the chance of the child to develop the obesity. So how we can prevent the childhood obesity? So alone we cannot prevent. Many multi-sectoral and the community involvement is needed, the schools intervention is needed. So in order to prevent this childhood obesity, number one can be community mobilization. Jingiasyllok lang haka imlang sa lang. So as a community, what we can do is we can organize and participate in health walks and healthy food festivals. We can give information about nutrition to the parents, especially to the mothers. Children's specific nutrition information can be given to the parents and to the family members, and the workshops can be conducted especially for the newly wed women. Safe walk can be provided. Bicycle routes can be given to the can be provided so that the children can travel through the bicycle to the school, and also to establish a therapeutic relationships and enhance effectiveness. The communication and intervention should be supportive rather than blaming, and family-centered rather than focus on the child alone. And we also should focus on the long-term goals, especially like behavioral changes or the behavioral modification related to risks of obesity. Obesity risks should be emphasized instead of focusing on the short-term goals, like for example, prescription on the diets or the exercise prescriptions should be avoided. And also we can give interventions through the early infancy and the perinatal period. We can start intervening not only when the child is growing, but before the child is born. Like for example, balanced nutrition to pregnant mothers, encourage exclusive breastfeeding. Exclusive breastfeeding means we are giving breastfeeding exclusively to the baby for 6 months, and not even water should be given to the baby, because we know that the breast milk is best food for the child. Avoidance of catch-up obesity in children, maintenance of correct growth velocity under guidance of physicians. Avoid excess nutrition to stunted children. Stunted children are those very short children compared with his or her age, and it is because of the chronic malnutrition. School-based intervention number 3, where the teachers can play a very important role in interventions or in decreasing the rising cases of obesity, where the school has to give high importance on physical activity, making healthier choices available, and a banning on unhealthy foods in cafeteria, unhealthy foods like sweetened beverages, colas, energy drink, etc., and also training of teachers regarding the nutrition education in cooperation of more knowledge about the nutrition, also physical activities and a nutrition related disease in the school curriculum. The fourth one is home-based intervention. The main or the key goals to address to the home are the common diet related problems which are encountered among the children, and by setting a firm limits on television and other media early in the child's life, and establish habits of frequent physical activity. So we can restrict watching TV or engaging in a computer to a maximum of 2 hours per day, and a minimum 60 minutes of physical activity has to be carried out by the child under the supervision of the parents, and a restriction on eating out at weekends, and the restricting availability of junk foods at home. The fifth one is, even though the home, the schools, and the community, they can intervene, but without the law, without the policy, all these interventions may not be successful. So how the government can intervene is that the first thing is that they can create a national task force for obesity, and also they should decrease in the taxes and the prices of fruits and vegetables. So we know that now There is a rising prices in the vegetables and the fruits where many of the families, they are not able to afford, they are not able to get access to these healthy foods. Proper food labeling has to be done in every food packages. There should be how much calorie, how much fat, proteins are there in that food items has to be mentioned, and the quality monitoring is very, very important. More playgrounds, parks has to be given in the community, and also the bicycle tracks has to be provided, and restrictions on advertisement, which is very, very important, especially of those commercial foods, those high dense energy foods on televisions, especially on the prime time, and also during the children's program has to be banned. And the government can also encourage the transnational food companies to manufacture healthy snacks. Prohibition of promotional gifts and junk foods, like nowadays we see in many shops where the children are attracted to junk foods, where the gifts are also given at the same time. You can see the suitcases, mobile phones, which are made it in the form of toys, but inside that one we can see a lots of junk foods is given there, where the children are attracted and they will eat it and they will consume it. Later on it will lead to a development of this childhood obesity. And also ban on monetary sponsorship of youth festivals by cola companies. So these are some of the preventive measures or the preventions in order to decrease or in order to hold the rising cases of childhood obesity. In a conclusion, I would like to state that effectively addressing the complex problem of childhood obesity calls for a sustained multi-sectoral response involving the public, private, health professionals, and the non-governmental sectors. This should also include various ministries joining hands together to promote healthy lifestyles and providing an enabling environment. The role of primary or secondary prevention is the mainstay plan for controlling this epidemic. The strategies can be initiated at home and in preschool, schools, and after school sessions. However, further research is needed. It's needed to be done to examine the most effective strategies of interventions, preventions, and the treatment of obesity. Preventing obesity in a child's earliest years and even before the birth by healthy habits during the pregnancy confers a lifetime of health benefits, and it's the most promising path for turning around the global epidemic. After all, saving the future or our future is in our hands. Thank you.